what we've been looking at is we've been looking at football players with the thought of whether or not the long-term changes that we see in their hearts is adaptive or maladaptive. And the reason we do this is we've seen in the past that even one season of football participation in freshman collegiate football players can lead to high levels of higher blood pressure, even overt hypertension. And with this, you can see some structural changes in the heart consisting of increased LV mass, left ventricular mass, and left ventricular wall thickness. So that's something that we're still trying to figure out. Traditionally, these changes that have been seen in football players, and they're predominantly seen in linemen who tend to be big football players, have been thought to be adaptive, meaning that they're part of this athlete's heart syndrome that you've spoken about, with the idea that part of their training causes their hearts to actually thicken and increase with left ventricular mass. However, what we've actually shown is not only do these football players develop some higher levels of blood pressure, but that the function of their heart over the course of a season actually decreases, which goes against what you would imagine with the athlete's heart syndrome. So in fact, what we hypothesize is perhaps the changes that these linemen are seeing are actually maladaptive, more similar to mild hypertensive heart disease rather than athlete's heart. So I think a lot of this information helps to explain some of the relationships that we've seen in terms of football participation starting at a young age. And then there have been studies looking at former NFL linemen showing that they actually have an increased cardiovascular morbidity and mortality, greater than 45 to 50% increase compared to the general population. So we're trying to bridge that gap and trying to understand why that may be, which alludes to that initial question that you had asked. I think some of it is probably related to blood pressure. A lot of people have talked about the weight, the tremendous weight that these players put on, especially in the transition from high school to college, as well as college to the professional level. And so we're trying to sort out how much each of these contributors really affect and how we as team physicians or as trainers can best impact these players, both in terms of diagnosing some of these diseases at a young age and potentially preventing long-term sequelae from them, like cardiovascular disease. I think there's definitely been an increased awareness of the neurologic impact of football participation, especially among linemen as well. And I think that's extremely important. I think as we move forward, the heart's going to have as well a bigger focus for these players, simply because that's what these players ultimately die of when they're in their 50s and 60s, these former NFL linemen. And so I do think that will have a greater impact. To be honest, the cohort of athletes that we looked at actually were at a similar Ivy League institution. They were actually at Harvard. I was actually at Mass General prior to this, so that was the cohort we looked at. But absolutely, the difference in training intensity in terms of how much pressure they have to put on weight is very different than you might see at a school in the Southeastern Conference or certainly at a professional level. And so we just haven't had those studies yet, but it'd be very interesting to see what the difference would be. I mean, the most important part to recognize about that is that these instances are extremely, extremely low. So the risk of this is low, but that doesn't preclude the fact that, you know, it does happen, and when it happens, it's a tremendous tragedy seeing how young these kids are. And also, typically in the community, we tend to think that these kids are all very, very healthy. So there has been a lot of focus in terms of thinking about how to best screen these athletes. And here in the United States, we still focus on doing a very good history, a 12-point history, and then using details from that history to decide, do you need an EKG, do you need an echocardiogram? And that tends to work pretty well. There's differences of opinions. If you go to Europe, many more people, for instance in Italy, will do an EKG as part of mandatory screening. So I think one of the big focuses, certainly from my end, is just thinking about how long-term exercise exposure can affect the heart, both good and bad. And it goes in many different areas. One other area that's been very interesting for a lot of people recently is what's the effect on the coronary arteries? Is there such a thing as too much exercise that it causes increased coronary blockage as opposed to being healthy? Another area is arrhythmias. Is too much exercise causing arrhythmias? And I think certainly for the football players, this is an area that's specifically important to the United States because we have so many football players and who start at a very young age, as you said. And they can be a very youthful population who may have high blood pressure, who we have to be aware of in terms of managing and treating them. There's two parts. I think the type of exercise is certainly important on its impact on the heart. We know that things that are primarily aerobic, to date there hasn't been any indication that it's bad for you to do a lot of it, but then we just don't know past a certain amount. There's the thought that it can put you at higher risk for certain arrhythmias like atrial fibrillation. Certainly for linemen, it's a different type of exercise. They're plowing each other at the line of scrimmage, have high blood pressures when they're doing that. Their training is primarily weightlifting as opposed to aerobic training. And so it tends to have a very different impact on the heart, for sure. I think the other issue in thinking about this is there's a difference between recreational athletics, so people who are just your weekend warriors or who go out trying to lose some weight and get fit, versus the folks that are competitive. They have different pressures on their training, and they may overtrain and push themselves beyond where they potentially should.